Hello, Namaskaram to all. A very warm welcome to 24th Parva of Prabodhini webinar series. So it is my immense pleasure to announce that we have completed 2 years of Prabodhini webinar. Since last 2 years we are conducting this webinar every month, and it is really very happy. I'm very happy to say that we have completed 2 years, and it is because of all of your participation and all of your blessings. So with this, we will start today's webinar, which is 24th episode, 24th Parva of Prabodhini webinar series. And before starting the scientific session, we will take the blessings of Lord Dhanvantari. So let us pray before the lotus feet of Lord Dhanvantari and take his blessing. So we'll start with Dhanvantari Vandana.
नमामि धन्वन्तरिम् आदिदेवम् सुरासुरे वन्दित पादपद्मम् लोके जरारुकभयमृत्युनाशम् दादारमीशम् विविधौषधीना धन्वन्तरिं रमानाथम् सर्वरोगनिवारकम् आयुर्वेदप्रवर्तारम् वन्दे पीयूषदायकम् सर्वे जना सुखिनो भवन्तु सर्वे सन्तु निरामया ॐ शान्ति शान्ति शान्तिः
So, welcome you all to Parva 24 of Prabodhini webinar series, and today's topic is Ayurvedic tools for diagnosis of snakebite, and our guest speaker will be Dr. Dilip Kumar Goswami, sir. And I think there is some network error from that side, so maybe they will join shortly. So I will give a brief introduction. Professor Dr. Dilip Kumar Goswami, sir, is the professor and HOD in Agadatantra department from I.A.Ayurvedic College, Meghalaya. And I welcome you, sir. Namaskar, sir. So,
Namaskar,
sir, we will start. I think there is some network issue from that side, so they will join us later. So, sir, you can start your presentation.
Okay. Thank you. I am starting now. So, namaskar to you all the participants. At the very outset, I express my thanks and gratitude to Professor Biswal sir and the today's anchor Pritimoi Sahu madam and all the staff of the organizers of this Prabodhini Parva 24 today. I welcome you all to this prestigious discussion on the important point on related with the snake bite, and I hope I shall be able to tell something from my side on the point on which you will be able to express your thinkings and your feelings and your experiences. I don't think that I shall be able to give you many new informations in this point, but I shall try to recall and justify some Ayurvedic classics, Ayurvedic important things in relation to the snakebite diagnosis. Because why I feel that in most of the times in my 27, 28 years experience and learning journey of Ayurvedic science, I have observed that actually Ayurveda is a very justified science, and in some points we are not being able to follow it. As a result, we are not being able to establish or stand with the Ayurvedic principles. So I will this program, and again thanks to you all for your cooperation and your affection to me to come to this platform. So this is the second one, please. This is our USTM, University of Science and Technology, Meghalaya. I express best wishes to you all from this prestigious university. Today's topic is Ayurvedic tools for diagnosis of snakebite. I am already introduced. So, and almost, I think most of you know me, whatever, maybe up to some extent. I am a student, I am a learner, I am a person, think myself that I should learn from my surroundings, from my juniors, from my seniors, from my colleagues, and I have a will to explore something from the Ayurvedic classics. So why I have chosen this topic? Because in most of the times, in relation to the treatment of different types of poisonings, we get many principles in the Ayurvedic classics also. And in most of the times, it is observed that they can also be justified, but practically there are some problems due to the research protocols, the practicing protocols, etc. We cannot use the Ayurvedic medicines in most of the times, because we are to follow the protocols of research and practice that is given by the different forums, like the Health and Family Welfare Departments of Government of India, the Health and Family Welfare Departments of the concerned states, etc. So I consider that let us today discuss about the points how we can diagnose the snakebite cases with our Ayurvedic knowledge only, and I shall try to effort. I am giving my effort to discuss on that point. Hope you will tolerate and you will suggest me to think in future. Next, please, sir. So, what I want to say, how important is the knowledge of snakebite for a physician? That is, sir, previously. Seriousness of snakebite in the world and the Indian population, importance of proper diagnosis of snakebite, Ayurvedic tools and techniques for snakebite diagnosis. Ayurveda is not mentioning about any instrument. Modern tools and techniques for snakebite diagnosis, applicability of Ayurvedic concepts for snakebite diagnosis, and at last, I want to give a take-home message from my side, which will be justified by you. So next, please, sir. So snakebite is a medical emergency. There is snake, generally it is a snakebite. Then there is every chance of resulting in fatal result. This is not only mentioned in the modern classics. Ayurvedic classics have also mentioned it. A common man considers snakebite as the messenger of sure death. When there will be snakebite, the person generally feels that after some time, after a few moments, I shall die, and the person becomes nervous. To deal with a patient of snake bite, a physician needs not only professional expertise, but also presence of mind. Because there are many things. The patient is to be consoled. The patient should give the confidence. The patient's guardians and the accompanying personnel should be given the consolation and the confidence, and they should also develop the faith on the person who is going to treat the condition. So not only with the theoretical and even the practical expertise on management of the snake bite, a physician cannot manage a patient of snake bite. So presence of mind, tolerance, patience, many things are needed. As per reports, 5.4 million people are bitten by snake each year worldwide. This is, I have got this data, it may be changed also, you may get some other data. Also, the value, the figure may be changed also. So whatever may be, it is not, it is a astonishing and the very huge quantity, huge number of people are getting affected with the snake bite during in the world. Next, please, sir. Out of the given population, that is the 5.4 million people who suffer from the, as per this data, who suffer from snake bite, 1.8 to 2.7 million are envenomings. So almost half, we can say, of the people who are suffering from the snake bite are envenomated. Annual death toll out of the 5.4 million is 81,410 to 1,37,880. It is also important. It is also to be noted that the death rate is also not less. A major percentage of snake bites are not non-poisonous. It is another important fact to know about the snake bite, and even the persons, the public should be made aware on this point. There is every chance of facing a case of snake bite by a physician daily, especially in the rural area. Each and every physician has got chance to face the snake bite case. Even every day we can expect. In Assam, the percentage is very nowadays reducing, but in some places till now the snake bite incidence is not less. Summer and rainy season are the most common time for snake bite. It is the observation, and in most of the times, snake bite, the fatal snake bite occurs during the summer and rainy seasons. Rural population is more vulnerable to snake bite. It is, and another important point should be kept in mind due to certain causes. We are not going to discuss on that point because this is today's topic is not directly related with that. Next, please, sir. India faces an estimated 58,000 snake bite deaths annually, which is said to be the highest snake bite burden. It is very important, and it is astonishing that these persons, 58,000 people are estimated to get the snake bite. I am audible pronouncedly? I am audible, madam?
Yes, sir, you're audible.
Okay, thank you. Only 25% of all snakes are said to be poisonous. It is another gift or boon to the human society that only 25% snakes among all the snakes are poisonous. Otherwise, it was very difficult to live for us. ASB is considered as the only treatment for a poisonous snake bite. This is known to us all. ASB application needs proper diagnosis of the patient. A non-poisonous snake bite can be managed by consolation and wound treatment only. If we shall be able to diagnose confidently that this is a non-poisonous snake bite, then it can be, the patient can be released with giving very simple treatment, the wound treatment only, and only by giving the consolation to the patient. We have got some patients, and we, when I was in Government Ayurvedic College, Guwahati, I faced such type of problem. Now, there was internet too. So it may cause serious type of allergic reactions, including anaphylaxis. Once I asked and told me that if there is no ICU facility, you should not use ASP, because it may be more and far more dangerous to the patient if there will be anaphylactic allergic reaction. Applying ASB in non-poisonous snake bite can cause serious reactions. So it is not safe. There are many precautions to be taken, and if there will be any fault in diagnosis and application of this ASB, then it may cause harm to the patient. So there is more and more importance to take the caution. So diagnosis is important, whether it is poisonous or non-poisonous. It should be first identified properly. Next, please. Ayurvedic classics advise the physicians to decide the following points when attending a patient of snake bite. Sarpadangsha. We correlate, we say that this is the Sanskrit term is Sarpadangsha. So when we attend a case of snake bite, we should decide these things first. Whether the bite is poisonous or non-poisonous. Sabishadangsha or Nirbishadangsha. It is important. This is the advice. If poisonous, then what type of poisonous snake is responsible? If it is a poisonous bite, then whether it is a Darbikara Sarpadangsha, Mandali Sarpadangsha, or Rajiman Sarpadangsha. Because the Ayurvedic classics has basically classified the poisonous snakes, the Sabisha Sarpa, into three groups: Darbikara, Mandali, and Rajiman. It is known to us all. We shall not discuss about the snakes. We shall now discuss about the Sarpa Dangsha. Next, please. The knowledge of examination procedure and signs symptoms of poisonous snake bite is must, as selection of appropriate treatment procedure is the only key for success in snake bite treatment. Because we have got, in the Ayurvedic classics, we have got 24 upakramas, and out of these 24 upakramas, we have to take a group of the treatment procedures which will give benefit to the patient depending upon the visha that is affecting to the patient, the condition of the patient, the condition of the ritu. So all these things we have to discuss, we have to think, and we should take decision about the treatment after appropriate diagnosis only. If diagnosis will be wrong, treatment will be wrong, and the result will also be disappointed, and we shall not be able to get the name and fame from the treatment. Next, please. So, Ayurvedic tools and techniques for snakebite diagnosis. From my observation, I shall place some points here. Saraka Samhita and Sushruta Samhita discuss. I have basically depended upon this Saraka and Sushruta Samhita, the signs and symptoms of poisonous snakebite, which guide the physicians in proper way. A discussion is made here on the topic. Before going to the Sarpadangsha, we are trying to draw your attention towards the Visakta Jantu Dangsha Lakshana, which is, I have observed, specially mentioned in the Saraka Samhita, Chikitsasthana 23, chapter 176, 178, Shloka. Next, please. So here I have started the table, Visakta Jantu Dangsha Lakshana, according to Saraka. The Hridruja, pain, feeling in the heart region, especially the heart is mentioned here first. It is a sthanic lakshana, but this is due to the remote effect of the Bisha. Shiruruja, headache is expected, can be expected, and it is again related with the head itself, but it is a remote effect of the poison. Then the sarvadohika lakshana, we can get jara. In some cases, this is Visakta Jantu Damsa Lakshana, poisonous animal bite, signs and symptoms. Then Stambha, there will be feeling of some disability to move the part, that is a Sthanika Lakshana. Basically, it is related with the part where there is bite. Sarvadohika Lakshana, again, we can expect Trishna, thirst. There are many things to be considered in these points. Then next, please. Murcha, fainting. The patient may faint. It is a sarvadohika lakshana, but this is manifestation of the poisonous bite. Kandu, itching. Itching can be expected as a local sign, because in these cases, generally the local itching is experienced by the patient. Nistuda, pinching pain at the site of the bite. Immediately the person will feel as if there is some pinching by some needles, and the patient will even may not be able to tolerate that type of pain. Vaivarna can be explained. I have interpreted Vaivarna as discoloration of the part affected where there is bite. That part may be discolored, and even it may extend to the other parts, the neighboring parts of the body, and even in severe cases, it may affect the whole body also. Shufti, that is the numbness of the part. It is a local sign where there is bite, there will be numbness. The person will lose the sense at that part. That is also important to be tested. Kleda, the person, when we shall inspect the part of bite, we shall see that the part is seen, the part is giving the appearance as it is too dirty, most dirty, and the dirtiness is increased. Upasosana, there will be some burning point, which is like the squeezing and pushing, pulling like burning pain. It will be expressed by the patient, which will be felt at the area where there is bite. Vidaha, there will be burning sensation at the site, as well as in some cases, if it is a very severe type of case, severe case, we can also expect the daha, that is the burning sensation of the whole body. Raga, it is a local sign of inflammation, which is always we see when there is any injury, there will be local reaction, and this raga, redness will appear, and this redness we can expect at the site of the bite. If the appearance will be red and more red, like angry red, we can expect that this should be a poisonous Jantu Damsha, poisonous animal bite. Next is Ruja, pain, local. It is a local sign. Paka, there may be suppuration, but this suppuration will not be seen at the immediately. If it will be chronic, if the person will not suffer from any unwanted result, then the part affected, the part of the bite, may be suppurated, pus formation may be there. So far, we can get it immediately. At the part, there will be inflammatory changes, inflammation will be there, and even may extend to some areas surrounding areas also. Granthi, the glandular swellings can be expected, which may be appeared surrounding the bitten place, bitten site, as well as even sometimes there may be generalized lymphatic enlargement also. Nikunchana, there may be some squeezing pain at the part, at some part of the, at the part where there is bite. the specific muscles may be affected, or a group of muscles may be affected. I have got some in one daily newspaper. It was seen that before some years I have seen that a person was complaining of some squeezing feeling of some muscles, and which was not being diagnosed by, after even doing many investigations. Ultimately, some doctor diagnosed, some doctor took the history, and he got the history that the person, before some years, the person suffered from rabid dog bite, and he diagnosed that it is the after effect of that rabid bite. So it may also happen, which is generally we never consider to be like that. But I have got such type of news in the newspaper before some years. Only one incident is in my mind. I have got like that. Dangsha, the part where there is bite will be blasted. Gradually the area of the bite will be increased. Then spota, there may be blister formation around the injury. Generally, we cannot expect the blisters in the other parts of the body, I think, but surrounding that, there may be, surrounding the part where there is bite, there may be some formation of blisters. Cornica, the periphery of the injured part may be alleviated. Mandala, this mandala can be felt by the person himself surrounding the bite, bitten area, bitten place, and even sometimes it may extend to some neighboring areas of the body, because this is due to the spread of the toxin in the body. It may happen. It may happen. Then, yes. Now these are why I have given this reference, because I understand, from my understanding, Sarpa is also a Jantu, and we can apply this knowledge of this Visakta Jantu Dangsha to diagnose the Sarpa Dangsha also. When the snake is poisonous, definitely it will inject the poison to the person through the bite side. So there will be such type of changes. Definitely we can expect that some group of these signs and symptoms will be there. So this is about the Jantu Dangsha Lakshana. It can be applied in all types of, from my feeling and opinion and observation, I think in all cases of bite, even in some other injuries also, we can apply it. So let us now skip to the Visakta Sarpadangsha Lakshana. Next, please. Yes. Visakta Sarpadangsha Lakshana, that is the Darbikara, Mandali, and Rajiman Sarpadangsha Lakshana. Definitely, according to our classics, 3 types of snakes definitely are poisonous said, and we have to differentiate. Number 1, whether it is a Visakta Sarpadangsha or Nirbisha Sarpadangsha. If the signs and symptoms of Darbikara, Mandali, and Rajiman Sarpadangsha will be present, we shall say, yes, this is a Sabisha Sarpadangsha, and this is Darbikara Sarpadangsha, or this is Mandali Sarpadangsha, or this is Rajiman Sarpadangsha. If not, they will be absent, then it will be Nirbisha Dangsha. So now I am coming to the point. The Darbikara Sarpadangsha, Mandali Sarpadangsha, and Rajiman Sarpadangsha, it is known to us all that Darbikara Sarpa increases the Vata Prakopa causes, Pitta Prakopa by Mandali, Rajiman causes Sreshma Prakopa. This is the base. This is the base to proceed for examination and diagnosis. Dangsha Pada, the sign mark of the Dangstra, the fangs will be there. Then there will be, in case of Darbikara, what will happen? Sukshma Dangstra Pada, it is very small. Then Prithu or Pita Dangsha, Mandoli, it will be bigger than the Darbikara. And in case of Rajiman, the bite is not described, but it is said that when we shall inspect the part, it will be as it is slimy. And it should be kept in mind that in any case of Jantudangsha, whatever may be snake, whatever may be, it may be another animal, it should not be touched by any person. Then the Varna, what will be the color? We are to observe in this way. Varna, Asita, black color will be there in case of Darbikara because Vata, Prakopa will be there. In case of Pitta, Mandali Sarpa, there will be Pitaba Varna, yellow color, discoloration. In case of Rajiman, there will be Pandu Varna, that is the pale color. Then about the Raktasrava, it is again important thing. Darbikara, in case of Darbikara, there will be almost there will be no bleeding. In case of Mandali, there will be Pita Varna Rakta. The color of the oozing or the discharge will be yellow in color. Sanrastik. In case of Rajiman Sarpa, the discharge will be thick because it is the Kapha Dharma. Then the Sotha, about the Sotha, in case of the Darbikara, it will be Urmabha. The middle part will be elevated and it will gradually slope towards the sides and it will be almost not round actually, it will be almost, we can say, oval shaped swelling. The middle will be elevated, it will gradually slope down towards the periphery. This is Kurmabha. Then Sotha, in case of Mandali, the Sotha inflammation, the swelling will be more. And in case of the Rajiman Sthira, it will not be too extensive, but there will be some swelling, and that swelling will be, though we cannot examine it by touching, then also it can be considered as a Sthira Sopa, which is not too hard, neither too hard nor soft. Then in case of the Darbikara Mandali Rajiman, we can expect, though it is not mentioned here, Darbikara Ruksha, we can expect. In case of Mandali, it will be hot, though it is not mentioned directly. In case of Rajiman, it will be Snigdha, because it is due to Kapha Prakopa. Next. Sarpadangsha Lakshana, that is the Saraka also mentions the signs. Importantly, very interestingly, Saraka has also mentioned the signs and symptoms of Purusha Sarpadangsha, Stri Sarpadangsha, Napungsaka Sarpadangsha, Garbhini Sarpadangsha, Prasuta Sarpadangsha, and Buddha Sarpadangsha. But since my knowledge has touched, I have seen that no treatment for these types of Sarpadangsha are mentioned in the classic. So I am not going, I have felt that this has got no specific utility in the treatment. So I am not going to discuss it, all these in detail, because I think these are, if we shall be able to differentiate the Prabisha and Nirbisha, and if we shall be able to diagnose the Darbikara, Mandali and Rajiman Sarpadangsha, that will be sufficient for us to take the decision about the treatment of the patient. Next, please. Now, the Susruta Samhita, what Susruta Samhita in Kalpasthana, 4th chapter, 37 number sloka, what is saying by Susruta? So, as per Susruta, in case of Darbikara, Mandali, and Rajiman Sarpa, I am saying in case of the Nayana, Bodhana, Krishna, it is, but this can be expected after some time only, not immediately. Tagadi Piktatta, again Mandali, Rajiman, Tagadi Suklatta. It is clear to us. Then Darbikara, Krishna Varna, the local appearance will be there, even it may extend to the whole body. Sita Bhilasa, the person may try to get, may expect to get the cold. Sita Jara, there may be fever, rise of temperature with chill and rigor, feeling of cold. Then Rukshata in Darbikara, In case of Mandali, Poridhupana, it is another type of peculiar type of burning sensation. Then Rajiman, Roma, Harsha. Since I think all are the Ayurvedic persons, so all can assume it. Then the Shiro Gaurava in case of Darbikara, in case of Mandali, Daha. Poridhupana and Daha is different. So Daha is only simply burning sensation, and Poridhupana is feeling of being heated with fire from inner side, internal side. Then Stabdatta, there will be again the person will feel that the part is not being able to move. Then Darbikara, Sandhi Vedana, Sandhis will be affected. Mandali, Trishna, Pitta, Rajiman, Gatranam, Adangsha Sopa. Even it may, there will be sopa, inflammation or swelling at the part, then it may extend it to the other parts of the body. Kati Prishta Griba Durballa, Darbikara, then Mandali, Mada, a state of delirium, the person will feel not be able to think stable. Then Sandra Kapha Praseka, discharge through the mouth, it will be thick discharge. Darbikara, Zrimba, Yaning, Mandali, Mursa, Rajiman, Chaddi. This is a generalized, this is a systemic signs and symptoms. Then Bepothu, trembling, the bending of the body. In case of Darbikara, Mandali, Jara, Oxykandu, Rajiman. It is an important sign to be considered. Sarabasada, in case of Darbikara, voice will be obstructed. Sunita, Gamanam, Urdham, Adasya. There may be, first there may be bleeding through the nose, then there may be some through the mouth, then anal orifice, in case of female vaginal orifice, in case of male urethra, and even there may be Sunita Nirgamana through the Loma Kupa. In case of severity, if the severity will increase, then Pantha Chayotu, there will be swelling of the throat. The person will feel as if the throat is being inflamed, and the person will get some problem in taking food, etc. Next, please. Next, please. Then Darbikara, Kurghurapa. There will be some sound from the neck, from the throat. Mangshanam, Abasatanam. In case of Mand, there will be necrosis, local necrosis. Then in case of Rajiman also again there may be, it is said Kurghurapa. It is also related with the throat. There will be some sound from the throat, from the neck, when the person will take respiration specially. Then Jarota, Darbikara, Jarota. We say paralysis, in one will be clear. Then Mandali, Shayothu, there will be again inflammation. Rajiman, Uchwasa Nirodha, there will be some obstructive, feeling of obstruction in the respiration. Then Suskudgara, in case of Darbikara, eructation, dry eructation. Mandali, Desha Kotha. Desha is the indicating the place of bite. There will be local necrosis. Rajiman, Tamah Pravesha. The person will go to a state of darkness. The person will see darkness in front of the eyes. In case of Darbikara, Kasha. In case of Mandali, Pita Rupa Darshana. Very important. In case of Darbikara, Swasa. In case of Mandali, Asukopa. Rajiman is already stopped in Tamah Pravesha. Then in case of Darbikara, Hikka, you know, in case of Mandali and Rajiman not mentioned. Darbikara, again Darbikara is extending. There will be a good number of signs and symptoms are mentioned, lakshanas are mentioned by Sushrita. Then Vayu Urdhagamana. Vayu Urdhagamana. Again, there will be problem in the breathing, and the person will feel as if his respiration is coming upwards, and the person will feel suffocated. Then Shula, Darbikara is continuing. Shula, pain at the side, even it may be extend to the whole body. Then Udbeshtana, there may be some cramping pain at the side, as well as it may extend to the some other group of muscles also in severe cases. Krishna, there may be thirst. lalasrava, the salivation, then phenagomona, through mouth there may be throaty discharge, then shrutu avarodha, there will be some obstruction in the shrutas, and shrutu avarodha lakshana will be seen, especially I think it will indicate the mala avarodha, mutra avarodha, etc., etc. So then, yes, then the as per Sushruta, what Sushruta says, Sushruta has also mentions important thing. The signs and symptoms of Purusha, again, Purusha, Shri, Napumsaka, Garbhini, Shutika, Grasarthi, Vriddha, Bala, and Andahika, Sarpadamsa. Again, in these cases, in these concerns, I have got no direction of the author, the principle of treatment, and I think this type of classification is not needed for treatment, so we are not going to discuss. Sushruta also mentions pranahara sarpadamsha lakshana. It is another important thing, that is, when there will be bite of the snake, definitely there will be death in some condition. And what is the basic, like I said, yes, shastra asonihata eva homo srastah sapiti. The person will feel on the ground as if the person is injured with very dangerous type of weapons. Sushruta discuss Sarpa Vishalakshana with respect to the 7 Vishabhega also, but we are not going to discuss the signs and symptoms of the 7 Vegas with reference to the 7 Vegas, because time will not allow, and I think it will be too critical. So I might myself feel some problem in keeping these signs symptoms with reference to the 7 Vishabhega and critical also. So whatever maybe time will also not allow, so we are not going to that point. I am sticking only this Visakta and Abhisakta. Then signs and symptoms of poisonous snake bite as per modern toxicology. Let us throw some light on the modern toxicology also. Basically, 3 types of snakes are mentioned: elapid, viper, and sea snake. Accordingly to the bites are mentioned: slight burning sensation in elapid, hyper intense local pain, in sea snake, no pain. Elapid bite, giddiness, hyper swelling; sea snake, generalized muscular pain; elapid, lethargy, hyper ecchymosis; sea snake, stiffness of the muscles starting from neck and limb girdle. Muscular weakness, severe muscular weakness, elapid; hyper severe oozing and hemolytic blood. This is Mangali Sarpa. Then sea snake, myoglobinuria, brown discoloration of urine; spreading paralysis, elapid. It is related with the Darbika Sarpadamsa. Then viper bite, seras or serosanguinous blister; sea snake, elevated serum transaminase. Then elapid, salivation; hypernausea; sea snake, hyperkalemia. Laboratory investigation. In case of elapid, vomiting; hyper is also vomiting; in sea snake, respiratory failure. In sea snake, the signs and symptoms, these are available, 2, 3, maybe more in other classics. Then in case of elapid, weakness in the legs, that is staggering; cold, clammy skin in case of viper; difficulty in speaking in elapid, it is also said in the classics, Ayurvedic classics; rapid feeble pulse in viper bite; difficulty in swallowing, elapid, kanthasotha; dilated pupils, viper bite; ptosis, elapid bite; then insensitivity to light, viper bite; then paralysis of extraocular muscles, it is an important thing in case of elapid bite; then complete loss of consciousness in viper bite. Then elapid, slow and labored breathing; hyper hemoglobinuria, bleeding will be there. Inability to speak in case of elapid bite. Ayurveda has also mentioned such type of things. Petechial hemorrhage, bleeding from the arms, hemoptysis and bleeding through the other body orifices. Hyper. Clear. Then cessation of respiration, elapid, respiratory paralysis, circulatory collapse into death. Then stoppage of heart function, elapid, viper, suppuration and superficial necrosis of the bite side, pitta. Then necrosis of skin and tissue surrounding the bite mark in case of ilapit. So all are clear to us. So general signs and symptoms of snake bite. I have given the diagram. I think this is a very good diagrammatic representation of the general signs and symptoms of snake bite. Central nervous system, what will happen? Vision, on the vision, what will happen? In systemic fever, severe pain, etc. Heart and vessels, what will happen? Pulse, blood pressure, shock. Muscular system, what will happen? Convulsion, loss of coordination, weakness, etc. With the gastric relation, gastric in the gastrointestinal tract, nausea, vomiting, intestinal diarrhea. In case of respiration, with the in relation to respiratory system, wound site, what will happen? Bleeding, fang mark, discoloration. So we have already got other skin sites, bleeding spot, numbness, tingling, sweating, etc. I think this is as I have got. I have this photograph, this diagrammatic representation facilitated me, so I shared with you. Now, signs and symptoms of venomous snake bite. All of you know drooping eyelids, swelling in the limb, then change in color of the tissue around the bite area, then the blisters in the bite area. Ayurveda has discussed with in relation to their appearance, in relation to their shape and size, everything they have mentioned in relation to the color also. So next, I am going to conclude because I think if it will be long, it will be difficult. Sarapa and Sushruta descriptions on the signs and symptoms of Visakta Sarpadamsa are interesting and informative. Buddhyasarya give nice guideline to diagnose the poisonous bite, which can be applied in all conditions of bite, animal bite, reptile bite, even in human bite or any other living object bite. So the Jantudangsha Lakshana, we can easily apply it. And according to the Ayurvedic classics, you know that before application of Agadatantra, we should always be sure that this is a poisonous. The condition is related with poisoning. Otherwise, if the Agada will be used in a condition where there is no poisoning, then it will cause harm to the patient rather. Describing the signs and symptoms of poisonous snake bite, both the Acharyas use three heads. Basically, they have given the poisonous snake bite signs and symptoms of poisonous snake bite, and these are the signs and symptoms of poisonous snake bite diagnosis. Darbikara, Mandali, and Rajiman Sarpadamsa. If a physician will be trained, I think like this, if a physician will be trained to diagnose the poisonous bite, then automatically he or she will be able to differentiate the poisonous and non-poisonous bite. If there is absence of poisonous snake bite, poisonous bite signs and symptoms, then it is a non-poisonous bite. So in case of non-poisonous bite, give the consolation to the patient, boost the patient's mind, that give the trust that this is a non-poisonous bite, and give the preliminary treatment injured part and the patient to. But if it is a poisonous bite, differentiate Torbikara, Mandali, and Rajiman and install the treatment. The modern toxicology describes the signs of poisonous bite basically under three categories: Ilapid, viper, and sea snake. This much I have got from my SARS, short-term SARS. Close similarity in the signs and symptoms of poisonous snake bite mentioned in Ayurvedic and modern science are observed. If we shall try to correlate, then all the signs and symptoms of Darbikara Sarpadamsa will come under Ilapid. All the Mandali Sarpa Dangsha Lakshana will come under the viper bite, and the sea snake bite signs and symptoms will come under the Rajiman Sarpadamsa Lakshana. Close eyes. So, from my side, what I have decided I want to share with you, and I request you all, like all other conditions, in case of snake bite also, proper diagnosis and differentiation of poisonous and non-poisonous bite is most important for a physician. in this case, we should be thorough enough and we should be confident enough. If we shall be able to diagnose poisonous and non-poisonous bite, and if we shall feel that this is a poisonous bite and we cannot manage it, if you will be able to refer the patient to an appropriate hospital, then it will be life-saving and you will be famous among the patients without giving the failing to differentiate a poisonous snake bite from non-poisonous one will lead to improper treatment and may cause death to the patient. Hence, every physician needs to be trained in the line. I think the Ayurvedic person should be thorough enough on the signs and symptoms of Visakta Jantudangsha Lakshana and Visakta Sarpadangsha Lakshana, especially in addition, the modern concept should be taken. Thorough and confident knowledge of Visakta Jantudangsha and Visakta Sarpadangsha can be utilized as the tool for proper diagnosis of snakebite, which may make the Ayurvedic physicians independent in the line. Sometimes we say we have no way to diagnose this disease, but I think to diagnose the poisonous animal bite and poisonous snake bite, we have got many resources and many knowledge given by our acharyas, and we should be confident and we should utilize it. I have tried to utilize in the cases when I got the snake bite cases during my previous service period. Now I am not experiencing the snake bite cases till now. So I have utilized and my diagnosis was right. I have developed that much of idea, though more and more trial observation is needed. So, going to conclude, let us try to utilize the Ayurvedic concepts in the practical field for the benefit of both the system and the human society. It is important, I think, we should be confident to try to explain, try to correlate with the modern science, the signs and symptoms or the descriptions, and we should establish that Ayurveda has got the criteria for diagnosis of poisonous bite and non-poisonous snake bite also. Poisonous and non-poisonous animal bite as well as snake bite. And with that, we should be confident enough and we should take this tool with us when we are going to attend a case of Jantudangsha or Sarpadangsha. So with this, I think time is from my side. I think it is okay. There are 20 minutes to be 4, and most of the times we take leave from our workplace by 4. Some areas it is 5. So I think you are. I don't know whether most of you are 4 or 5. My time is 4. So I think I have tried to tell something to you, share with you, and I hope you will also give me some input, not only me, to other participants, and I hope your inputs will expand our knowledge, and I shall be happy to listen from you also. I think you will share, and the organizers will allow to share the knowledge and the experience of the participants also, at least for some time. So with this, I again say pranam to you all, and I hope for sometimes we may not be invited as the speaker. Then also I shall come with you. I shall join with you as listener. Please give me information when you will organize your program, and I shall join with you. Whatever may be my condition, I am not thinking that always you tell me, you invite me as speaker. I shall listen from others also as a listener. Today also I am a listener, but I have told something from my side also. Yes, okay. Again, thank you all. Pranam. Let us hear from the others also on this point. Okay, thank you. Over to the organizers.
Hello, Dr. Preeti.
Yes, sir. Yes, sir. Sir has ended the session, and I was about to invite you because in the starting there was some network error, and we didn't got a chance to see you on screen. So I will invite Dr. Surendra Kumar Biswal, sir, Professor and HOD from Agadatantra Department, Shri Babu Singh Ayurvedic Medical College. So, sir, you can now play your part and take over this session.
Okay. Unmute. Hello, I am audible.
Yes, sir.
Yes,
Yes, sir.
sir.
You are audible.
Okay. Dear participants, very good afternoon. First up, I would like to be apologized because due to some network issue, I could not invite our chief guest, chief speaker, Dr. Dilip Goswami sir. So I on I beg pardon from him. Uh, Actually, he is my best friend and he is very good personality, eminent person. So, mm, I would like to say something about our chief speaker, Dr. Goswami. Uh, is an eminent person and he is dedicatedly, voluntarily working. As today we know that he is voluntarily and dedicatedly speak, though we could not invite him. So it is, you can also judge that he is a dedicated and volunteer working in the field of teaching field from since long period. Dr. Dilip Goswami. At present, he is HOD in professor, HOD and professor in the Department of Agadatantra in I.A.Ayurvedic College, uh, Meghalaya, that is University of Science and Technology, Meghalaya. Dr. Goswami completed his UG in Guwahati University and PG from Utkal University, Odisha, and PhD from Shriman Kankardev University, Assam. He started his academic career as assistant professor at Assam, and then professor in at Sri College of Ayurvedic Science Research Hospital, Cuttack, and now as professor in at Meghalaya. Dr. Goswami has prepared more than 40 papers in different webinars and seminars and published more than 33 articles and in different journals and also published 5 books which are very also these are one thing and atlas of poisonous plants very essential to our department, MCQ on Agatantra and Vidivadyak, essentials of Ayurveda, Atma Chintan, I think it is a holy, it is a Atma regarding book and handbook of forensic medicine and toxicology. He is also honored as editorial board in 5 index journals. He is also uh, honored with more than 17 awards in different activities. Hmm. At last, before I conclude my talk, I would like to thank all of you, all of the participants at first, and I would special thank to our chief speaker, Dr. Dilip Goswami sir, who is an eminent person, good person, moral person. So we definitely call you again, sir, and I will be thankful to our honorable chairman, sir, Dr. Shailendra Jadhav, and our chairperson, madam, Dr. Sunita Yadav, principal sir, vice principal sir, and my all colleague, Dr. Shivam, my subordinate, associate professor, Dr. Shivam Chaubey, and assistant professor, Dr. Sanoop. So, and again, also, I would thanks to a special thanks to Dr. Pritimai Sahu, because though she is some distance from us, but with this Zoom, we got very nearer to her. So I would like to thank her eh, so much and so much. And uh, with this, I would like to conclude my speech. And Dr. Pratima, you can
Thank you
next.
so much, sir. As we know, when hearts are connected, distance does not count. So hearts are always connected, and I will be always there for Shri Babu Singh Jai Singh Ayurvedic Medical College, being my first college. So we can take, I think, 1-2 questions if anyone have doubt or anything to ask to our guest speaker. So you can put in the chat box. If you have 1-2 questions, we can take. Still, we have 10 minutes. So if anyone have any doubt, you can put in the chat box. Yeah, we got some question. One question is there, sir. See, is there any difference between venomous and poisonous? Sir, Dilip,
Repeat,
sir,
please. Yeah,
is
yeah.
there
Repeat,
any
please.
difference? Is there any difference between venomous and poisonous?
Actually, venomous and poisonous, the difference we cannot say too clearly, I think, because venom is also poison. But if we shall say poison, then we can say that it may come from other roots, through other roots also. But when we shall say that venom, especially in case of the snake venoms, it will be injected to the victim through the dangstra, through the fangs only. So like that we can say, but very minor difference is there if we can say. But in most of the times we can use it as synonymous.
Yes, sir. So, Dr. Amol, I think you're clear now. Anyone else who want to ask any other question or you want to share your experience can raise your hands. What remedies can Ayurveda provide if a snake bites me and others? So, it is a question from Dr. Arun Kumar. What remedies can Ayurveda provide if a snake bites me and others?
Bites me and
And others means if
bites.
any snake bites, so is there any remedy in Ayurveda?
Yeah. Actually, there are many things mentioned in the Ayurvedic classics. I think you know also the question is coming from whom. But the problem is this: I think, we have got very less experience. So, and there are some international protocols also. There are some law binding in the law also, because the treatment that is given by the traditional healers are also mentioned in the Ayurvedic classics. But a traditional healer can give the treatment to the patient, whatever may be the result, because there is faith of the persons, individuals, as well as they are not bound with the laws of their practice till now, as I know. But in case of us, the Ayurvedic practitioners, when we are the registered medical practitioners, we have got some bindings. We have to follow the rules and regulations, and we have to think about the international protocols, national protocols. Many things are to be considered. So, I think we can claim theoretically, but practically we cannot claim as the registered Ayurvedic practitioners to give the Ayurvedic treatment. For that, more and more research is needed, observation is needed, and the recognition from the international scientific forums and the national forums are needed. So I invite the new generation to work on that point, the classical points. The 24 upakramas should be evaluated. They should be tried in different steps by taking the appropriate permissions from the recognized and the authorized authorities of research, and it should be established. But from my side, I cannot say that we can give this Ayurvedic treatment in the cases of acute snake special. In case of chronic snake bite, there are some protocols being followed by the South Indian persons. In our place, the incidence is very less, so we are not too much experienced. But we can do something in the chronic ulcerations, necrosis at the site of the bite of the snake. But in the acute cases, we should not. Till now, we are not. We cannot or should not take risk. I think like that.
Yes, sir. So we should actually follow the protocol because it is the matter of life and death condition, and we should not go for any trials there because we have to save the patient's life is the primary aim, I think. So,
Yeah.
but post emergency management, we can go with Vishahar Chikitsa, Lepas, and everything are described in Ayurveda. So we can follow those things. But it is just post emergency management. So first you have to do the emergency management, anti-snake venom and everything.
When the fear of fatality is not there, then we can do. We can do, and I think it will be successful also. If there is no, when the fear of fatality will go, but in the acute cases we can take rest.
Actually, sir, maximum deaths occur due to fear only. Fear factor is there, and patient goes into shock, even if the snake is non-poisonous. So that is the thing. And many people are asking that is there any emergency medicine Ayurveda which we can give? So I think there is no emergency medicine in Ayurveda which will be given in acute stage. So first you have to go for proper diagnosis, then you give anti-snake venom, whichever is the appropriate one. And then post management, after this managing the acute condition, we can intervene with Ayurveda procedures. Right, sir?
Yeah.
So I think any other question other than this emergency treatment from Ayurveda side? Any other question if it is there? So you can ask. So sir, if you are going with Vishahar Chikitsa, then any you can just tell some medicines or some single drugs which can be used in these conditions. So many people are curious about that.
No, actually, since we are not exposed to the cases of the snake bite as the and we are not providing the treatment with the Ayurvedic protocols, because here in our place, even the post-bite complications cases are also very less. And we have seen that when there is death, when there is bite, especially by the black cobra is available in our place. When there is bite of that by that poisonous snake, the person dies. And here, the incidence of the viper bite is also not more. So we are not experiencing such type of cases. So I cannot give the practical experience in these cases because it is not tried and the practical result is also not good. To be frank, it should be said
Still,
that
more studies are needed in this matter also, in this field also. More studies are needed to establish actually whatever is whatever is described. No, we need more studies. So maybe new researchers who are doing PGs and PhDs, they can take up these topics. But still it is a matter of risk because in these conditions, patients normally doesn't go for Ayurveda treatment. But maybe we can try.
Yes,
Okay,
yes,
sir.
yes. It could be the mission.
Okay, so we don't have any more questions, sir. So we'll end this session here. And I'm very, very thankful to everyone who are present here, all the delegates, our chief guest speakers, our Prabodhini team, and all the faculty members of Shri Babu Singh Jai Singh Ayurvedic Medical College who have joined us today to make this Parva 24 successful. And with this, we end our today's Parva 24 of Prabodhini webinar series. And I will expect all our delegates. We will meet again in the next episode next month with a new guest speaker and new ideas and new knowledge. And you will gain maximum from us. And it will be our effort to provide you whatever we have, whatever we can try. So with this, we end this session and you will be receiving your e-certificates within next 7 working days. So please be patient and be with us. and support us in every step. So thank you so much. Namaskaram to all.
Thank you.